No, I don't know either. I'm live, everybody! Welcome to SPSM. April does it again. She does it every week.
Bart's gonna fling a little knowledge at us and hit us square in the eyes, talking about suicide prevention history. I learned things about the assassination of Abraham Lincoln I can't unlearn or unthink.
Which side are you on? Okay, so now we've had some dead air time. Bart Andrews, would you do the intro for Christ's sake?
I, Dr. Bart Andrews, puppy snuggler, intrepid explorer of Topeka, and safe messaging skeptic, will tell a story from the history of mental health treatment to my friend
Chris Maxwell, who has no idea what the topic is going to be about.
The Fixation is where SPSM takes time to explore the sometimes wild and wacky history of mental health treatment and suicide prevention. June 6, 1900! That little-known fact, Tony Wood, Maimonides was also known as Ram Bam. Twitter was mostly clay tablety, and so Twitter was a little slow. Just think about this for a minute. Can you imagine Manfred's talking to his friend Johan and is telling, he says to Johan, you said you were going out of town this weekend. Do you need somebody to dog sit for you, Johan?
Not only was Manfred flaky, but he was just the worst dog walker.
No. He's like, everyone's depressed. Let's knock them out with insulin.
And what ends up happening is insulin shock therapy, insulin coma therapy comes to be a really big deal.
Like insulin happy fun time nap time. Like make it a little bit more appealing.
Yeah. It was sort of like pate, but for your coma.
And in fact, he claims that he had an 88% recovery rate with his insulin coma therapy, right?
What?
Now, but also sometimes people died. Maybe
so it's important to get the money up front, is what you're saying.
Laszlo is very different than Manfred. Laszlo is not flashy. He's very research oriented, very detailed. He begins using very
Austrian.
He's very Craig Bryanish.
These would still be considered illegal human experiments by today's standards.
And I think one of the things that we don't realize is back in this day that there was zero treatment for people fighting schizophrenia.
For this to be okay, people were incredibly desperate.
As heinous as we find this, these two were pioneers in their day in terms of really making the connection between the mind, the body, the brain, and behavior. ECT got a really bad rap in the way that it was done and often misused. And if you one flew over the cuckoo's nest, all that kind of stuff, right?
This kind of stuff is as barbaric as the story Bart says. Like the options were not great, and this did work and did relieve pain.
We haven't found a significant reduction in suicide that's connected to SSRI treatment. We have numerous studies supporting that ECT does in fact reduce the suicide rate in folks in randomized controlled studies.
There's a lot about mental health treatment where the risks and benefits, I don't know that it's every patient's experience that they go and the doctor says, well, here are 6 treatment avenues. Let's discuss the risks and benefits. I don't think that happens a lot.
But we could be getting a lot more people, a lot more effective treatments than we currently do in our current system.
The story of innovation is often messy.
I think that it's absolutely malpractice to not at least discuss and then have an open, honest conversation about the use of ECT. And I bet that doesn't happen very often, is my guess.